The United States of America is in a crisis. The powerhouse of the world is facing a problem that only the scientifically illiterate countries are facing. The United States of America is experiencing the anti-vaccination movement, a movement to suppress vaccinations. Although vaccines are crucial for curing and preventing diseases, the anti-vaccination movement has been here since vaccines have been invented due to a lack of scientific understanding. The recent anti-vaccination movement claims that there is a relationship between the MMR, mumps, measles, and rubella vaccines and autism. This false relationship stemmed from Andrew Wakefield, who started this recent movement after he published this paper that claims that vaccines cause gastrointestinal disturbances in certain children, causing certain chemicals and toxins used to break down food to enter the bloodstream, where they can cause damage to the brain, leading to autism. However, it was later found out that Wakefield fabricated his data. Also, the scientific consensus is that there is no evidence for this relationship. Even with this information, politicians, parents, and celebrities are trying to allow children to easily opt out of the vaccination program, which is dangerous because it can lead to the disruption in the herd immunity, thereby putting every children at risk who truly cannot take vaccines due to medical problems. This is a social issue against humanity because it can indirectly result in someone else's death. Due to this recent movement, some diseases that are thought to have been eradicated have popped up drastically. The graph provided by the CDC, Centers for Disease Control, shows that there is a rise in measles cases and that there was a spike in 2014 with 159 cases. The trend seems to be pointing to an increase in the number of measles cases. The majority of the people who contracted measles were those who were unvaccinated. In the United States of America as a whole, a whopping 5% of kindergartners are not vaccinated, in which the southern states have the most amount of unvaccinated kids. This is an embarrassment to the nation and puts tremendous risks on children who are susceptible to deadly, preventable diseases. In the US of A, there are state laws that allow for vaccination exemptions. The three types of exemptions are religious, philosophical, and medical. These different states have different degrees and difficulty of being exempted, and we can see that states that have easy and medium difficulties are seeing a rise, meaning that more and more people are opting out to their non-medical means. In that very country, 26 states have now reported meeting the government target of 95% coverage for MMR. 48 states and the District of Columbia allow religious exemptions from vaccines, while 20 states allow philosophical exceptions. A study done by the Public Health Report, the official journal of the US Public Health Service in 2011, found that 70% of parents who choose not to vaccinate their kids believe that vaccines are necessary, while 63% of parents fear negative consequences. 57% of parents are concerned with autism, and 78% of parents believe that children get too many shots. Surprisingly, families of unvaccinated children are more likely to be wealthier, white, married in an English-speaking household, college-educated, and covered by health insurance, which seem contradictory to the purpose of education, as education is supposed to teach the public to know better. The implications of this continual anti-vaccination movement are quite severe. The recent trend in this movement indicates that children could have been cured could die. There could be community outbreaks of outdated diseases, and the herd immunity could collapse, resulting in preventable deaths. This movement is a social deviant act and is causing a negative change, so it has to be addressed so that more people won't die. To address this, we have to treat this problem similar to the classical deterrence theory. Firstly, the cause of this problem is a lack of scientific awareness and education. So healthcare professionals and science educators must be taught how to combat misinformation by making the science easy to read, understandable, and accessible to the public to increase scientific literacy. They can do so by using popular shows and popular media to quench the social panic, such as Sesame Street. Also, educators should try to connect to families and friends about immunization, as people more readily trust their families and friends over doctors. The second solution is by allowing the federal government to enforce stricter laws for non-medical exemptions by making the process more difficult by placing large amounts of taxes, time, and law investments that could take years to process. That way, similar to the classical deterrence theory, because it takes time and is not certain, more and more people will decide not to pursue this path. Finally, a third potential solution could be shaming the anti-vaccination movement. According to Gizmodo, a technology-based website, shame is a powerful weapon in the American society, as history shows that shaming can reduce a certain ideology. For example, the KKK, Ku Klux Klan, was shamed and ridiculed non-stop with the use of a radio show, The Adventures of Superman. The recruitment of this group dropped to basically zero because people soon did not want to associate themselves with the KKK, since people did not want to feel dumb. Therefore, the goal of shaming is to make this movement as unpopular as possible, such that it is not considered acceptable by the American society via constant humiliations and satire via famous comedy shows, such as South Park. With these solutions, there can be hope for a healthier and smarter United States of America. A nation where kids can play freely. A nation where kids don't have to worry about other kids. A nation where you want to live in.